Hey guys, what's going on? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipelines. Visit my website at hairliciously.com to purchase your microneedling device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DHT debulking shampoo, conditioner, and serum, hair growth vitamins, and a few other products to help those who are losing hair. In today's video topic, I wanted to talk about minoxidil and specifically how often we need to apply it per day to maximize our hair growth potential. There's been a growing controversy on the number of applications required per day. So in this video, I just wanted to give you guys my thoughts and share with you a few studies backing this information. Now, minoxidil is one of two FDA-approved hair loss medications that is applied topically. And the mechanism of action minoxidil works by is that it acts as a potassium channel opener, causing hyperpolarization of cell membranes, which helps widen blood vessels for things like oxygen, blood, nutrients to get to the hair follicles and flourish. It's been readily available over the counter through its brand name Rogaine, in addition to other generic brands. And both men and women who are suffering from androgenetic alopecia have been using it at different concentrations, ranging from 2 to 5% for well over 2 decades to treat hair loss. As you guys know, one of the things that I have been taking and currently take for the past 6 years to treat my androgenetic alopecia is topical 5% minoxidil. I apply it twice a day as recommended, morning and at night, and I personally feel that it's been a great arsenal to add to my hair loss treatment stack in maintaining and also the ability to stimulate hair growth. I feel that it works exceptionally well when it's paired up with microneedling or derma rolling, and this is something that I highly recommend everyone to try if you have not added to your hair loss treatment regimen. Now, the issue of minoxidil frequency came up when people started realizing that the half-life of minoxidil is actually around 22 hours, and given its relatively long half-life, it would theoretically make sense to apply it just once a day as opposed to twice a day. But with that said, there are people on different hair loss forums and trust lists, who were stating that they were getting by using minoxidil once a day, whereas other people were complaining that once a day application was not enough and that it didn't yield them good results until they switched back to using it twice a day. So before we dive any further into this topic, I will note that though, if you lack sufficient amounts of the sulfotransferase enzyme in the hair follicles that is required to convert minoxidil into its active form, minoxidil sulfate, you guys likely are not going to see any good results regardless of how frequent you use minoxidil. There are things like tretinoin cream that can enhance minoxidil absorption or response by upregulating follicular sulfotransferase enzymes. But if you're lacking the specific enzyme, there's no point in you taking topical minoxidil, and you'll very likely have to look into something like oral minoxidil, since taking it orally will first pass liver metabolism, and it is going to work more efficiently since there are no issues with cutaneous delivery and penetration. There was an older study that was published back in 1987 titled Long-Term Follow-Up of Men with Male Pattern Baldness Treated with Topical Minoxidil, and it looked into the long-term effects of using minoxidil at different concentrations. 41 men with male pattern baldness completed 133 study weeks with topical minoxidil and had follow-up 1-inch target area vertex scalp hair counts. Initially, these men were treated with either twice daily 2% topical minoxidil for 12 months or 3% topical minoxidil for 8 to 12 months. After 12 months, all subjects continued to apply 3% topical minoxidil twice daily for 1 more year, after which they were randomized to once versus twice daily topical minoxidil for an additional 9 months. At the end of the 2-year, 9-month study, turned out that subjects who had changed to once daily application of topical minoxidil at the onset of 2 years had a mean change from baseline non-vellus hair count at 1 year of 291.2 and at 2 years, 9 months of 235. Those subjects who continued with twice daily application of topical minoxidil throughout the study had a mean change from baseline non-vellus hair count at 1 year of 323 and 335 at 2 years, 9 months with maintenance topical minoxidil. There was a greater mean loss in those patients following the once daily versus twice daily topical minoxidil regimen. So obviously, the study benefited those who had used minoxidil twice a day as opposed to using it once daily, and it also did show a higher number of hair count as a result. So This study, I feel like, does confirm that using minoxidil at the recommended twice daily frequency as opposed to using it at once a day is going to be more efficacious in maintaining and promoting hair growth. I think minoxidil users also need to realize that just because scientific data show that topical minoxidil has a half-life of around 22 hours, it doesn't necessarily mean that the half-life will be exactly 22 hours for every person. There's a lot of variables and factors that can influence this, and it is going to vary from person to person based on certain things like, what age you are, how well or poorly a drug is distributed around the person's body, how fast a person can excrete the drug, pre-existing medical conditions, or even certain medications that someone has taken in conjunction with minoxidil, which can cause reactions to potentially alter the half-life. So this means that for certain individuals, the half-life of minoxidil may actually be a lot faster and warrant applying it twice a day. It might also go the opposite way. But unlike 5-AR inhibitors like finasteride or dutasteride, systemic minoxidil accumulation resulting from frequent application is unlikely, and a study from 1989 titled Absorption of Minoxidil After Topical Application, Effect of Frequency and Site of Application actually confirms this. And because another study in 2019 titled Minoxidil and its use in hair disorders, a review shows that pharmacokinetically approximately 1.4% of topical minoxidil is absorbed in the scalp. This means nearly 99% of minoxidil that is applied is wasted away. The only way to increase the absorption is by changing the frequency of drug application. If 1.4% of topical minoxidil is being absorbed in the scalp, this is going to be under the most ideal scalp conditions, no sebum buildup, nothing that is hindering the effects of minoxidil being absorbed. So ideally, given that, first of all, minoxidil won't accumulate systemically due to frequent application, and the fact that not a whole lot of minoxidil is being, absorbed or when it's being applied in the first place, it would only make sense to stick with applying minoxidil twice a day to cover your base. Not only are you guys increasing the possibility of better absorption by applying it twice a day, you're also preventing the concentration of minoxidil from lowering by applying it more frequently before it actually reaches its half-life. Topical minoxidil is a relatively safe drug. It has a very good safety profile, and most users will not experience any adverse side effects. If you're already applying it once a day, you really shouldn't have any issues applying it twice a day. I even had people who reached out to me who were complaining about the fact that, it's such a hassle to apply it twice a day, and that they would commit to it more if they can just get by with applying it once a day. But to be honest, it's not even that difficult applying it once in the morning and once at night. And I feel like the key to good hair growth and maintenance is to be consistent with your treatment. I know that on YouTube, some of you guys probably heard of the channel Hair Loss Show out in Australia. And I remember, I believe he's in India. And I remember one of the Indian doctors saying that applying minoxidil once a day was going to suffice. But then he never really gave a good scientific answer other than the fact that the half-life for minoxidil was 22 hours. And that companies like Rogaine would basically lose money if they advertise using minoxidil once a day as opposed to twice a day, since it's going to take twice as longer for consumers to use up a monthly supply of minoxidil. So in my opinion, given all of these circumstances, it honestly doesn't hurt to apply minoxidil twice a day. Obviously, it's better to use it once a day than not using it at all. But like I said, you're simply putting yourself at an advantage using it twice a day, especially if studies do show that it's more efficacious using it frequently. If you're worried about using the liquid version and how messy and greasy it would make your hair, I would highly recommend that you look into the foam version. A lot of it doesn't have PG. It's less greasy, it dries up a lot quicker, and it's not going to make your hair look like crap. If you're just starting off and hesitant about using it twice a day, play around with the frequency. Try it for a few months using it once a day, and if you're not seeing any good results, try going for twice daily. Some people may get by using it once a day, or maybe you've been using minoxidil for a few years and want to try using it once a day and see if you can maintain all the growth. Try it out and see what works for you, because what may work for you may not work for someone else. As far as myself, I am going to stick with twice daily as recommended. I will also add that if you are using minoxidil, make sure that you guys are leaving it on your scalp for at least a minimum of 4 hours before washing your hair. There is a study that shows that over 75% of minoxidil is absorbed by 4 hours. So if you're washing your scalp within an hour or two after applying minoxidil, you're not really getting the full efficacy of minoxidil. Anyway, that wraps up this video, guys. Let me know in the comments what your thoughts are on using minoxidil once versus twice a day. Thanks for watching, guys. Make sure to give this video a thumbs up, and I will talk to you guys in my next video. Take care.